Alrighty then, here we are on page 225, part 6 of the axial skeleton. We're beyond the skull now, and we're also beyond vertebra, and we're on to the ribs. In our previous episode, we spoke about the sternum, the manubrium, the body, the angle of the sternum, the xiphoid, right? And let's not forget the jugular notch right up here. Now there's a trachea that slides behind there that we don't see in this view, but it's there. And we also learned about the osculatory points for listening to the heart in the previous episode. Now we have 12 pairs of ribs, the last two of which are 11, 12, are floating ribs. And if you reach around your side and just slightly posterior to the immediate side, then you'll find little pointy areas there. And you'll note that in anatomy, further in the book, we'll see that there's kidneys that are being protected back here. Meanwhile, we have 12 pairs of ribs altogether, 10 of which are connected here with some degree of hyaline cartilage. And then if we look carefully over here, we'll see that the first 1 through 7 are referred to as true ribs. And let's examine why that is. The first rib comes around this way and connects to the manubrium. The second rib to the sternal angle. The third, fourth, fifth, sixth, and seventh ribs connect directly to the body. And then what you'll notice is rib number 8, 9, and 10 have their costal cartilage coming through rib number 7. Okay? So 7 is the last one that independently touches the sternum by itself. So 1, 2, 3, 4, 5, 6, 7. This is the 7th rib. And then after that we have 8, 9, and 10. And they come around and they actually fit onto the costal cartilage of number 7. Okay? So these are referred to then as false ribs 8 through 12 because ribs 8 through 10 do not connect to the sternum and directly. They only connect indirectly, and 11 and 12 do not connect at all. Okay, so they're sort of an incomplete protection compared to as if we were, for instance, a turtle. Turtles, if you examine them carefully, actually have ribs that are completely fused together, and they have a complete plate in the front here so that they can emerge in and out of their little box, as it were. Okay, so that takes care of the ribs in terms of number and position. Then let's take a closer look here at some of the details of the rib over on page 226. You'll discover that the rib has certain features that they're not discussing so clearly. Let's take a look down here at this picture. Okay, so this picture is better. This is a posterior view. That's the head. It comes around this way. And now if you look inside the inside of the acute angle here, do you notice how they're pointing to the costal groove? So that's an inside feature. It's a groove. It's actually what I would call a subcostal groove because it's at the bottom. Okay? And it's a groove that houses what I refer to as a vein, artery, and a nerve. They're called the intercostal vein, the intercostal artery, and the intercostal nerve. So not so creative, but nevertheless, it works really well. And sometimes when they're bundled together, as they often are this way, sisters, as it were, of artery, vein, and nerve, vein, artery, and nerve, is they're in the same connective tissue, and they're referred to as neurovascular bundles. Okay, so as you're dissecting along in the cadaver, which we're not doing this semester, but if we were, we would find that there's this sort of big, sort of hose-like feature coming along, and we don't realize that there's actually 3 things inside that, and that you have to sort of tease apart all the connective tissues, and then you go, oh, look at that, there's a little hose in there, that's the artery, there's a little floppy little kind of a hose, and that's the vein, and then there's a hard, almost harder than muscle, kind of like tissue that comes along, and that's the nerve. So that's being protected in there. Is it possible that if someone breaks a rib that there's pain? And the answer would be yes. Broken ribs are painful. And could there be any bleeding involved? And the answer is yes. There could be some bleeding involved. So things like that can happen, and expect, because this is protecting something, that thing which is being protected is not necessarily intact anymore. Then we have the tubercle of the rib that comes around this way. By this point, it's already touching a vertebra. Then we have the neck. Then we have the head of the rib, and that's actually touching a vertebral body. Over here at this end, we should be seeing costal cartilage, which is ultimately going to make it over to the sternum. Okay, now here we have the situation where we're kind of like coming around this way, and I've shown you this before. The rib sort of circles around the side and then finally the back of the body, and the head of the rib is actually going to two bodies. You see that? There's two little demi-facets right there. There's a bigger facet where the tubercle of the rib fits into the transverse costal facet. Now, in this case, it's actually fitting into this one. You can't quite see it. So they tip it over, and they let us take a look here. And here is our tubercle articulating in the transverse facet. Okay, and we have some ligaments holding everybody together. We have the head touching a little tiny portion of the body right there. And there you have it, just the way you like it. Okay, so those are ribs, and we're all set with that idea. Now we're going to be moving on to the appendicular skeleton, and I'm going to begin a brand new playlist for that. So let's conclude right here, and I'll let you think about all of these things the next time you go to a rib shop or something like that for takeout, and you can see if you can find everything just the way you like it in your anatomy.